Well, good afternoon. I'm Dr. Paula Duren, and I'm the Director of Universal Dementia Caregivers. And every Thursday we come to you and we have some conversation around caring for a loved one, could have dementia or any other illness, but we want to share information and stay connected with you. Because we normally have training sessions where we're in the room and sharing information and connecting. But today, because of the pandemic, we find ourselves in a totally different place. But we want to stay in touch. I received a number of calls from people, and in those calls, what they've done is they were asking me for information about how to keep their loved one hydrated, because they're finding that many of their loved ones are dehydrated, and it ends up with them being in the hospital. So I have invited a guest, a nurse. His name is Peter, and I know Peter's going to mess with me if I mess up his name, Ferenzi, from the Detroit area.
Very good, Dr. Duren, very good.
I can destroy some names, but from the Detroit area aging agency. And he has been in the nursing arena and caring arena for over 35 years. And I wanted him to be here today because when you call, I said, I can give you my opinion, but I'm a psychologist. I'm not a nurse or physician, but I wanted us to just have a dialogue with Peter. And if you have questions, feel free to send us a note on Facebook. We'll commit to getting them answered. But this is a big issue because what happens when we become so dehydrated, they may end up in the hospital, or you're at home and you're so frustrated. And I hear people say, I can't get them to drink anything. I don't care what it is, they won't drink it. Well, our guest today will help us with that. I'd like to first of all welcome Peter and say welcome to our space, and really looking forward to having a conversation with you today.
It's truly my pleasure, Doctor.
Thank you very much. Let me just step back and just tell us just a little bit about who you are.
My name is Peter Ferenzi. I'm a registered nurse with a bachelor's degree in nursing. Currently, I'm a supports coordinator, as you said, which supports coordinator is similar to a case manager with the Detroit Area Agency on Aging. Our agency has been around for 40 years, serving the population in the Detroit area, including the Grosse Pointes, Harper Woods, Hamtramck, and Highland Park. Mostly seniors and younger people who are medically disabled, assuring they get the care needs that they have met in their home if that's truly is their desire. And for most people, they prefer being in their home. And most families, caregivers prefer that as well.
Well, thank you. And in all full disclosure, we are partners with the Detroit Area of Aging and do a number of things together. And I'm very excited that you were available today, knowing that people are very busy, even though we're not necessarily at work at the office, we are truly at work at home. So let's just start out in terms of a definition. What is dehydration, Peter?
Dehydration itself occurs when the water intake is not enough to replace the water that's lost by all of our bodies throughout the day, through urination, breathing even loses water, perspiration certainly can, and or if people become nauseous and vomit and or have diarrhea, you're losing all sorts of fluid, which a lot of it's water, some of it's chemicals and electrolytes that the body does need, which is where a lot of our seniors get into trouble. All of a sudden, their mentation has greatly declined and we don't know why. Most frequently, hydration, urinary tract infections, which can be secondary to dehydration, are leading causes of some of our seniors suffering and or being hospitalized.
Let me slow you down and let me just pick apart some stuff so we can make sure people get all the points that you just gave us. So is dehydration fairly common in older adults?
Yes, it is. This time of year especially, although in the winter it can be too, because a lot of our seniors have their homes quite high and their interest in drinking isn't always what it should be. Like you mentioned, the people that have sent notes to you saying that, I can't get mom or dad or grandma or grandpa to drink anything in a given day. There are other sources of fluids that we'll talk about when we get into more of the treatment.
Okay.
But yes, definitely.
And so if I have a loved one and I'm starting to worry about them in terms of dehydration and drinking fluids, what kinds of things might I see in them? I mean, you know what I'm saying? If would they look different? Would they behave different other than not drinking? What should I be looking for?
Prevention, an ounce of prevention is worth a pound of cure. We know that. So every day, if you're helping them, include oral care. Stick out your tongue. You see, my tongue's a little white. I'm a little bit dehydrated right now.
So I'm looking, when they stick out their tongue, I'm looking for the color of their tongue?
Yes, it should be pink and moist.
Okay.
As well as if you're helping them with, and you can kind of sneak it in while you're doing it. It's part of the daily care. Okay, grandma, grandpa, mom, dad, whoever it is, we got to brush your teeth now. Even if you have dentures, okay, we got to clean up your gums. Check that out. Look for moist, pink, oral mucosa, if you're interested in the medical terminology. That's a good place to start. Monitoring their oral intake, which is hard. You have to ask open-ended questions. Did you drink enough water today? Sure, they'll answer. That's all I wanted to drink.
Especially if there's some level of cognitive decline. I already drank that water.
Mm-hmm. Measure out the water, measure out the fluids, keep track, keep a certain number of bottles of water in the fridge a day. Other things like juices can be good. All of this has an asterisk by it based on physician recommendations. Regarding diabetes or kidney problems are two things that you can't suck down as much juice as some of us can on these hotter days.
But let me just ask the question, why is it important that we stay hydrated? What happens to the body, or do I fall out? Do I get confused? What happens?
The long-term problems that can develop pretty quickly, you can pass out. Commonly, even among younger people, the high school athletes, they go, if I don't know if high school athletics is going to be happening for a while, but they're training certainly, and they're very cautious in the area that I live in. Water breaks are whenever you think you need a water break. They've gotten to that point. When I was growing up, it was like you go through practice, you get a drink after practice if you're lucky. So definitely passing out. It can be something as serious as seizures. All sorts of things, bad things can happen. That's right. Why, again, the ounce of prevention is worth it.
Okay. And I was thinking about what you said, and one of the things you said we should pay attention to is the color of their tongue. I heard something about they may stop sweating if they sweat at all, or they may start. I know as a wannabe athlete, I was going to say athlete, as a wannabe athlete, if I'm dehydrated, I get cramps in my legs.
Absolutely.
And so it's just, I'm trying to think about other things I could tell people to pay attention. My understanding is that my heart rate increases, that I might have increased heart help me with the right word.
Palpitations.
Thank you very much. Needed a nurse to tell me that one. And then some people even get dizzy if indeed they don't have enough fluids in their body.
Certainly, dizziness, lightheadedness, muscle cramps. Frequently, my wife and I go to water first, and then we look for a piece of fruit, because typically potassium is one of the first things we lose with dehydration, and fruit is one of the best sources of it. Again, within doctor recommendations based on diabetes, renal failure, kidney failure, that sort of stuff. But half a banana. Honestly, if I walk to the kitchen, grab a banana, by the time I get back to bed, any muscle cramps gone. Partly because I've actually got up and used those muscles. Okay. And partly because of the potassium from the fruit.
All right. So then you gave me like 6 or 7 things I could start paying attention to with my loved one who is starting to refuse. And I know it's really frustrating for the caregiver, because they're trying to do in addition to everything else they have to do, it gets really frustrating. Yet you just emphasize the importance of that fluid intake. So most times as people think about drinking water, you just gave us some other options. There's some fruit that we could pay attention to. Watermelon, I'm sure, is a really good one. Then someone said soup, certain kinds of soups could be helpful. So people often think I just have to get them to drink water. And it's much more than that, because as options for increasing the fluid.
There are ways to get fluids in the system, again, within their dietary restrictions. Jello, good old hospitals push Jello a lot. It's not just because they can make it easily and it's tasty. It gets you fluids. What do you know? Okay. There's a method to the madness. Yes, and honestly, anything, ice cream, soups, watching the sodium, read the labels, anything you get in the store. Natural, fresh things are best, but lots of fruits. If you wring out any fruit, you get all sorts of liquids. Or if you're a juicer, you can see all that liquidy stuff is water based, and that is all good. And you can hide. We use Crystal Light or Hawaiian
Mhm.
Punch flavor packets. They're sugar free. Put that in water, it tastes wonderful. It really, I mean, I can tolerate water, but I can't really get down the 6 to 8 servings of water that we should have a day of plain water. You also have to be careful with things that are hidden diuretics, which are hidden water pills. Caffeine, horrible. People think, well, I drank my 2 cups of coffee today, that counts. The water that's in there is pretty much removed by the caffeine that's in there, so that
Really?
really doesn't count. Yes, we're glad you were able to drink that. That's wonderful. Why don't we chase it with half a cup of juice? Or remember, a little sizable amount of water. If you put a big gulp container next to a lot of seniors, they're not going to finish it. Put a
Right.
little cup, a 6, 8 ounce, a juice glass kind of, have it by them, have it cold if they like it, or have it room temperature if they prefer. All those are different things that can be used to get fluids/water into the body and help prevent that dehydration.
Okay. And the other things that we kind of play with, I often tell the caregivers, it's you indicated, you should be monitoring it. Just kind of pay attention to how much fluid you're giving them.
Right.
Because I think you and I discussed briefly, you can drink too much and have too many fluids in your body.
Absolutely, absolutely. Your legs can start to swell, depending in congestive heart failure situations. You can throw yourself into that by hypervolemia is a fancy term for too much fluid. Hypovolemia is more in the dehydration category. But yes, certainly, I've seen people that drink gallons and gallons and gallons, and you're just asking for trouble. That's way too much burden on your system, especially your kidneys.
Okay. And so if we were going to give people some strategies, because I've been little strategies about things they can do, because after this, I want to talk about what happens when they have to go to, how do I decide when it's time to go to the hospital? Some of the things that we have suggested, much like you have done, the smaller cups versus trying to give people great big things. And we also do like the hospitals do, you know how they put the time and date on the cups? That way we know how much, we kind of keep record of it. We also, as you indicated, putting in some things that change the taste of the water is very important. Paying attention to the other health issues. I also have seen that if you put whatever you want them to drink in decorative cups, it's almost like, what do they enjoy?
Right.
And do they like things that make noise? I've even seen people have these cups like with the little bells on the bottom, or their little fish moving around in there. And so looking for ways to not only get them to, they're entertained in the process of drinking water. So those are some other little ones that we have used successfully with some of our caregivers.
Absolutely great ideas. And we have to remember our seniors, especially those that are getting in dementia, they're still there. And they recognize that they're the adult, they're the mom, they're the dad. And if you're overemphasizing the care that you're doing, you kind of have to sneak things in. If you're overemphasizing that care, they're thinking, now, wait a minute, you're treating me like I'm the baby.
Right.
I'm the child in the relationship. You have to let them know and remind them, give them input. You know what, which cup did you want to use today? Which this, which that, which flavor of, Crystal Light do you want me to put in? What flavor of water do you want? You don't have to use the names. Do you have any preference, or is it okay? You just want me to spin the wheel and pick which I want? Including them in the care planning. As advanced as the dementias can be, they're still there. They're still that person. They're the person that you love. It can be frustrating sometimes because your roles have reversed, but you need to treat them with dignity and respect, because if it's 10-20% of their mentation is left, that's important. You want them to remember you love them and respect them as the parent in the relationship, and you're kind of showing it by providing them with food and fluids, which Maslow's hierarchy of needs, oxygen, food, and fluids, that's the foundation. Without that, there really is no life.
Right. That's the base. And it's two of the things we emphasize at Universal is honoring the person. So we're right on place, because I just believe sometimes people think that because they are at various stages, especially at the advanced stages of dementia, they think the person's not there. The person is still in there. The challenge is for you as the caregiver to learn how to touch them. And see, we want to bring them out. Peter, we want to just heal them and bring them out and make them well. So we just keep kind of trying to pull them back into my space and say, you know, you understand you need to drink water. It's good for you. I say, take all that rational love that you're trying to give them and focus on their space, their world, and how do I get in there with them and honor and respect them in the process. So I'm very happy that you said that.
Absolutely. It's so important. You put yourself in their position. If, like I said, if it's 10 or 20% of their mentation left, I don't want to be talked to like I'm a baby.
Right.
Even if that's all, you know, if the few minutes a day I have a little bit of lucidness, I attend a dementia workshop online, and one of the participants said that I know my dad knows what he's doing. In some ways he is. In some ways he's resentful of your care because he's not the dad in his eyes anymore, because he's requiring the care from head to toe, feeding, nutrition, hydration, toileting, sometimes cleaning up uneventful toileting episodes. So know that sometimes it's acting out, but it's not acting out of hate. It's the disease, and it's some of the few things that they can feel that they control. And
I think helping us to remember that, what will we do if someone took all of our independence? As independent as we are, if someone was not going, okay, you're just going to sit there and you're going to allow me to do everything. And I keep telling the caregivers, you're doing it out of love, yet you're doing it out of frustration at the same time. And sometimes they actually get angry with them. And I step back and say, ask yourself the question, if I am arguing with someone who is in advanced stages of dementia, who doesn't understand that I'm arguing other than from my spirit, they know your energy. Who looks crazy in that picture? So it's kind of like helping the caregiver to step back and see that, you know what, they still have the need for independence. They're still in there. I need to know how to touch them and honor and respect them and give them space. And when I get frustrated, it's time for me, maybe I need to breathe or just give myself a moment away and then come back. Because I really believe, Peter, that they may not know your name. They know your energy and they know your spirit.
Absolutely. And there's still that bond. There's still love in there for you. And if they see you being angry, it's like, oh man, they're one of my few people that I know and love, and now I've made them upset.
And they're the ones who's working to try and take care of me too. And so you never know what fear could occur at that point too, because they might start feeling abandoned or worrying about being abandoned. All right, let's go to this piece, Peter. If indeed, when would you tell me it's time to take them to the hospital regarding the dehydration?
If the oral intake has decreased, usually 6 to 8 glasses, cup sizes of fluids a day is essential. If you're noticing that their urination has decreased and or become very concentrated, you can tell that by color. It gets a dark yellow to orangish color. I've even seen it get darker than that. It also has a foul odor. Normal urine is usually not awfully odorous, but dehydrated urine definitely is. There are ways that we nurses tend to do things without even paying attention. We come up to someone in the hospital and just gradually feel their hand and pinch the skin just gently. If the skin tense, if it stays up, that's a sign of dehydration.
So what you're watching for is how long it takes for it to go back into place.
Before it gets back to normal. Some people never do. I've been little old ladies. Old grandmas and great grandmas, you ten it sometimes, you pinch it up and it stays there for your whole conversation. Finally, you smooth it out yourself and move along. More clinically, things like blood pressure, pulse, that sort of stuff. I try not to get into that in the home unless it's a younger person that's capable of it. It can be overwhelming because then you do feel, man, I feel like a nurse. You know, I'm working a job probably, and then I go home and I have to work. You know, I have to do the whole thing that a nurse would do in a hospital or nursing home. That can be overwhelming. Sight,
Okay.
what you're seeing, sunken eyes, thinning of the cheeks, dry.
What about orientation in terms of being oriented to the moment, time, and place?
Very much so. You need to work that into your daily assessment with your loved one. Sounds technical, but hey, mom, how you doing today? Do you remember? I mean, you can't hit them with same questions every day. Because a lot of people, they'll start answering questions before you ask them. You know, President Trump's the president. It's the summertime. It's that. Blah blah blah. Hit them with other questions. You know, how many children do you have? Do you remember all of Bob's children's names? Bob's your son. You can help orient them and say, okay, he has some children. Do you remember how many they are? And you'll get, maybe they'll start maybe guessing names or maybe throw out a number. But again, it's an open-ended question. It's not a, does Bob have 4 kids? They can say yes or no to that. You're giving them the answer usually. And you don't want to trick them. You don't want to contribute to any
additional confusion at all.
not true facts. If you don't want to fight with them about it, but you don't want to contribute to it. Sure, Bob's got 47 kids. No, Bob doesn't have 47 kids.
But if I were reiterating some of the things you said, when it's time to probably take them to the doctor or to the hospital, I read somewhere about if they have had diarrhea for like 24 hours, that you might consider that, because as you indicated earlier in the conversation, that they're losing lots of fluids as a result of that. You also said if the urine is dark and has potentially a smell to it, because you said normally would not necessarily have that,
Right.
or bloody or black stool.
Mm-hmm.
I'm trying to make sure, I want folks to make sure that they can walk away and say, these are some signs that I might need to be paying attention to more. So now that I've paid attention and I've called the doc and I'm taking them to the hospital, what should I expect?
They would start checking vital signs right away. They would, the nursing process is, which is kind of the general scientific process, assess first, plan, implement, and evaluate. They would check them out originally. They would ask questions, some orientation questions, some, you know, what's your name, what's your address? And while they're looking at the patient, they're looking at the family member too, not wanting the information, but to know if it's true or not coming from that person.
Right.
If they are disoriented, that's an automatic alert that yes, things are going on. Altered mental status is a common emergency room diagnosis. And typically, sometimes a bag of fluid is all they need. Sometimes a couple bags of fluid. And just the fluid itself. It usually doesn't need anything fancy in it. No necessarily sodium or potassium or anything like that. That can be uncomfortable going through an IV. But while they're drawing labs, they're checking to see, okay, they've had diarrhea and you say for too long. We're going to check and see where the electrolytes, which are the key chemicals in the body, where those levels are. If they are too low, we can give you things orally and or through an IV. And frequently, it's not a hospital stay unless things are so advanced that you miss the signs ahead of time. Most frequently, emergency rooms, especially nowadays, nobody wants to be admitted. They really don't want to admit anybody. They don't have to. Usually within a hospital observation, 24 hours, if it's early stage dehydration, they can treat it and the person can go home.
So that's early stage. Suppose it's a little bit further along, and let's assume, because I recall I took care of my mom and dad before they died from dementia-related diseases, and we ended up in the hospital a number of times, and they ended up keeping mom in particular, and it would felt like, Peter, 2 to 3 days to rehydrate her, and then they had to make sure she could walk again. So then they had to do the rehab piece. Right. And I felt like, and I don't know, maybe you could help others understand. I felt like we got into a cycle. It was near the transition of her life, and we got into a cycle. She would become dehydrated no matter what we did. Take her to the hospital, they'd keep her, they'd rehydrate her, send her away for physical therapy. She came back home, and then within a short period of time, similar things started happening. And the UTI was usually the indicator that we needed to do something. Have you seen that before?
Absolutely, absolutely. You see people in the hospital that literally just have the diagnosis, mental status change dehydration, which insurances aren't keen on paying for over and over and over. They're trying to get away from that. So they're coming up with plans and ideas, and they're expecting physicians to come up with plans and ideas to prevent constant readmissions for the same problem.
Right.
It's causing an incredible financial burden and an incredible emotional burden for families that have to, you got your loved one that you're taking care of in their home or your home or in a comfortable place for them. And then boom, for several days, they're not. And you know, you're going to get that call in the middle of the night.
Yes.
Mom's more confused. She's
Absolutely.
screaming. She's this, she's that. She got out of bed. She almost fell, or she did fall. So boom, you went in with dehydration, and now there's a more
all to
serious
deal with.
injury. Yes.
Okay. So then, sounds like though, if we could put our loved one on a routine where we monitor and track and engage them in the process of making decisions themselves and keep them involved on rehydrating, but make it a priority, knowing that it's not just water, but there's food, there's fruit, there's, at one point we even went with something like Ensure, because it was a fluid, it had a lot of the healthy stuff it needed, but find ways to, and then even engaging them in pretty cups and experiences, and even sometimes you could even make it fun. That the average, I'm going to say average, a lot of that can be handled at home versus taking them to a hospital.
Sure. And that's where the ounce of prevention. All people can do is the best they can do. All you could do for your parents was the best you can do. And there's times when it's needed to go to the hospital, right. And not when you're at your wit's end, but when you don't feel, and when you use common sense and decide, you know what, this was bad yesterday, it's worse today, whether it's diarrhea, nausea and vomiting, any of those symptoms where we lose tons of fluids and hardly realize it comes because it happens so quickly. And if they're on the toilet, you know, they have a bout of diarrhea. Sometimes it's flushed before you even closely evaluate what it was. Yes, definitely preventing the advancing of dehydration is really key. One thing I wanted to bring up is all pharmacies have a thickening agent that you can add. If some people say, I just can't drink water, or if they've had a stroke, sometimes they don't have the swallowing ability. Every pharmacy has, Thicket is a brand of it, thickening agent, and or you can almost do it yourself, put in a little bit of cornstarch and a lot of stuff thickens up. Not sure of the chemicals in cornstarch, but that helps, and it gives them a little chewing as opposed to just drinking down the liquid. A lot of patients who especially have had strokes need to have that because they'll choke on water or milk or anything that consistency. And there's a variety of different consistencies. You go from water like to thickened to pureed based on their ability to swallow. So you have to remember that too. A lot of it, if it's vascular dementia, usually caused by a stroke, a blood clot, or an aneurysm in the brain, there's damage up there, and that can affect speech, swallow, movement. All that's important to take into consideration. That's where we include the physicians in the planning of care, and the therapists in the hospitals and nursing homes or skilled rehab or skilled nursing facilities, whatever term we're using today. That's where we include all those people. That's why everybody gets a speech therapist in a nursing home or in a rehab, because we want to make sure they can swallow. That's the fundamental thing. If they're not getting air, food, and fluids, all the exercise in the world don't matter. And
I want to reemphasize what you said. When you start talking about changing the care plan that you and the physician have agreed to, it's essential to reconnect with that physician because I know I was notorious for trying to be a doctor myself. So I had a doctor on call who would help me say, Paula, no, you can't do that. Let me do that, or this is not care plan. But we included each other, as you said, to ensure that. You mentioned something that someone else talked about. We had a swallowing assessment done of my mom. And so people, can you tell me what that is exactly? If someone's out there and they're worried that their loved one is having problems swallowing?
There's different kinds. Sometimes it's just they give somebody something to put in their mouth, see what they do with it. They see if they chew it, they see if they move it around their mouth. Some people will swirl it up in their cheeks and leave it there. All gone. No, yeah, it's all gone, but what about this here?
Right.
You didn't have that one. You're not chewing tobacco, so shouldn't have a chubby cheek at the time. There's other more invasive ones where they give people something to swallow, and under fluoroscopy or x-ray, they can see if it's going down, if it's going down smoothly, if it's leaving the mouth, going into the throat, going into the esophagus, to determine if it's going down into the stomach smoothly. If it's not, they're considered failed, and that's where we have to change them more to a liquid diet. So people who didn't like liquids to start with, suddenly that's all they can have.
That's all I have.
And that's really a hard thing for caregivers, but let's look at the patient, the participant, the loved one. Hard for them too. Man, I can't have, anything, or everything I have to have needs to be pulverized.
That's right.
Yeah, maybe I can have chicken or beef, but it has to darn near
be liquid
with a spoon.
Right.
Yeah, or a straw. And like I said, straws, depending on the swallow, especially with stroke patients, need to be cautious. Well, you think it's a great thing to do, suck up on a straw. Some people, it sucks right into their lungs, and then they aspirate, and you have all sorts of other medical problems.
Okay.
So you've tried to fix one problem and caused a couple more.
I want you to know you have been such a treasure. I mean, you just know so much about the whole human body and how it all works. I appreciate it because I think the caregivers have heard some real insight from you. I'm gonna say this and then ask you if you have any closing remarks. One of the things that I know with caregivers is they want to help so badly, and sometimes wanting to help gets in the way. Not that you're hard, because I really want to help. I want to fix it. Sometimes the best thing to do is to step back and monitor it and look at it and engage the person in a slower process, and know that you're doing the best you can. People get on themselves. I had to take her to the hospital. Well, that's okay if you had to do that. Give yourself permission to do the best you can, versus assuming you know everything there is to know, and you're the best trained person in the world, and you may be, but there's still some things you don't know. What words would you leave with our caregivers?
Remember that they are still the person, the patient is still your loved one, and you're doing the best you can. Use physician guidance, use family, friends. Careful about becoming a Facebook physician. You're not going to learn everything from internet and certainly from Facebook. Sorry, Mr. Zuckerberg, if you're listening, but
well, I sure hope he's listening.
Well, he's working on the vaccine for COVID right now. So.
That's right. That's right.
You are doing a good job. I've worked in hospice. There's times when family. You talk about burnout. It happens. It doesn't mean you loved your loved one any less, but there's a time to step back. I listened to someone yesterday say, well, I just need to get away for a week or two. And they were supportive, but I'm thinking, and I didn't say it, but what if your loved one died during those couple of weeks? Be close enough by, still be in their life. But yeah, taking a little bit of time for yourself is key, because
you have to.
You're looking at 24/7 care.
That's
and
right.
They're being on your mind 24/7. Even if you're working and have your own children and family and life, they're still on your mind. Every time your phone rings, you think,
that's right.
Oh, is it? How bad is it? So it's important to take care of yourself so that you can take care of others in the nursing world and in families, the loved ones that you really want to have the best care.
I always tell the caregivers that if you're not healthy, you're not giving healthy care.
Right.
And it's really important, like the airlines used to say, put on your own mask first. Take care of you so that you can have a clear mind, a clear heart, a healthy body in order to care for someone else. Again, it's a gift, Peter. Thank you. And to my caregivers, thank you. And I hope that we have reason to talk again. I really do.
Thank you, Dr. Duren. Have a nice day.
Thank you. And to my caregivers, anyone who's watching, the first two people that sends us a note about anything that you learned from Peter's presentation, I will send you a gift from Universal Dementia Caregivers, which we are providing for many of our caregivers. It is a box of love. It's a care box, and in it is some PPE and some hand sanitizer, and of course a candy bar. So send us a note.
Dr.
Yes.
Duren, if I could add to that, I'd like to send something from myself on behalf of DAAA to the third person who sends in something they might have learned from us. I'll have to put it together. I don't know what it's going to be. My wife is shopping for something.
Good. Thank you very much again, and I look forward to talking with you again. Thank you all for watching. First 3 people sends us a note on Facebook that tells us something they learned with Peter today will receive gifts from us. Have a good day.
Thank you. You too.